So one person's doing CPR, the other person runs out to get the AED. If you're the only one present, you can run out and get the AED as long as it's not too far away. If it's going to take too long to do, just flip your phone out, hit 911, begin CPR, and communicate to them. And then if any passerbys come by, tell them to go get the AED. So once the AED arrives, the good thing about AEDs is they all have the same steps to follow. So if you've used one or you've been trained on one, same steps are going to apply. Now they may differ on how they turn on. Some turn on just by flipping a top, some have a button. So once the AED's there, push the button, it'll tell you what to do. First thing it's going to tell you to do is bare the chest. So get the clothing off so that you can get to the chest. Then you're going to have to wipe them down if they're all sweaty from having a heart attack, or maybe they were in a pool and drowned. We're going to have to wipe them down and get them dry. Shave the area so it'll come with a razor, upper right, lower left. We don't put the pads on the upper left because they could have an implantable device. So if they have a built-in pacemaker, we don't want to put anything over that implanted device. If they have a necklace on, a wired bra, nipple rings, necklace, any of that has to come off, anything metal, because it can interfere with the AED's ability to analyze. So we've wiped them down, we've shaved for the pads, we're going to hook the pads up. Now these won't stick because they've been used a lot in class, but most of your pads will tell you where they go, especially if it's a fairly recent AED. So we're going to go upper right and lower left, and we're just going to have to pretend these stick. In real life, we would be concerned if they didn't stick. So let's say they stuck there, right? I'm just going to remove them for now. So the pads are upper right, lower left. Once the pads are on, that gives the AED the ability to analyze. So warn everybody, analyzing, stand clear. The reason that's important is cell phones can interfere with an AED's ability to analyze a signal because of the EMFs that come off of it. So if somebody has a cell phone or you have yours, it needs to be more than 6 feet away from an AED. So if you flip that out to talk to 911, it needs to be on speaker and far enough away from you or it'll mess up the AED's ability to analyze. So once it analyzes, it's going to tell you one or two things. Either shock advised or no shock advised. If it says no shock advised, it's going to tell you to go into CPR. You just keep doing that until it starts to analyze again, and then you go hands off and let it do its job. If it says shock advised, before you give the shock, you need to give another warning. Everybody stand clear, shocking. Once everybody's clear and nobody's touching the victim, hit the shock button. Hopefully that'll reset the heart and take them out of fibrillation, and so the heart starts to beat again. So once you've given a shock, it's going to tell you to recheck for signs of life. So recheck for signs of life, check for a pulse, check for breathing, look down the body, see if you see them breathing. If there are no signs of life, begin CPR until it tells you it's analyzing again. If there are signs of life, you want to roll them over into the rescue position and monitor their condition. Notice that I put the AED on my side. I don't want to put it across here. I don't want to be reaching across using the AED because I could accidentally touch the victim when I give a shock. So make sure nobody's touching the victim and that the AED stays on the same side as the operator.